Hi, I'm Steve Canarian. I am the medic mentor. I'm here with Jason Hums, manager of the St. Anthony's Flight Service in Rockford, Illinois. Jason, why don't you tell us a little bit about yourself and what flight medics do?
Oh, thanks, Steve. First of all, it's good to have you on today. What I do is I'm the manager for Lifeline Helicopter at OSF St. Anthony Medical Center in Rockford, Illinois. I'm also the president of the International Association of Flight Paramedics for 09 and 10. We really encourage paramedics to look towards a career in flight medicine. We look for paramedics who have 2 to 5 years of paramedic experience in a busy 911 system. Then we ask them to take it a step further. Take a critical care class. Start doing critical care transports on the ground if possible. Because about 80% of our flights are critical care transports. 20% are scene calls. So those critical care transports, we are having our paramedics trained to the same level as an ICU nurse.
Interesting.
Yeah, we want them to take care of the ventilator, balloon pumps, IV lines, medication drips. We can handle 9 IV drips at a time per patient on the vent, all these invasive lines that you see in the ICU, we do all that right here in the helicopter.
So a lot of times medic students will ask me how they can become a flight medic. What do you suggest? What do you suggest for paramedics that want to be flight medics? How do they prepare to line themselves up for what I believe to be a very competitive line of work?
It is, first of all, it is very competitive. For one part-time position, we average about 50 applicants.
Yeah.
And this is in Rockford, Illinois, which is about 2 hours outside of Chicago. So in other areas, it's even more competitive. What paramedics should do is, when they complete their schooling, first of all, continue all those certifications. Every flight paramedic needs to have the pre-hospital trauma life support, CPR, ACLS, PALS. We also need them they should look towards their critical care certification, either flight paramedic certification or critical care paramedic certification, the new national certification that just came out. The other thing is continuing education. We want paramedics who can take it to the next level.
Right.
So those are ours. We want the ones who can talk to the physicians, who can challenge the physicians on 12 leads,
right,
on diagnoses, and who are interested in finding out what happens.
The critical thinking advanced medics who look at this job as an education and not an hourly job.
You're absolutely correct. And all of our transfers, we're at a level 1 trauma center, we're a chest pain center, we're a stroke center. So if we pick up a patient in an outlying hospital, those are the patients that local emergency room can't handle. They need help. They need to get the patient out. So that's when they call us. And we have to maintain the same level of care as our emergency room would.
Are there any online websites you can think of that would be useful for paramedics that want to become flight medics?
There are a number of them. There's the organization that I'm the president of is flightparamedic.org. It's the International Association of Flight Paramedics. For their national certifications, it's the BCCTPC, Board for Critical Care Transport Paramedic. So bcctpc.org. There are many other. There's the flight nurses are out there. See what the competition's doing. See what the other professions are doing. So that would be the Air Medical Physicians Association, the Flight Nurses Association, which is ASNA, Air Surface Transport Nurses Association. See what they're doing and see what the profession is doing.